conclusion to the show. So thank you guys for sticking around. Really appreciate it. My name is Steve Crow. For those who don't know, the chair of RoboBusiness. We're part of the same team at the Robot Report, also the Robotics Summit and Expo, and this is probably the funnest and most interesting thing I've ever done at one of these shows. So I want to welcome to the show Tori Smith. He's the co-founder and CEO of Endoscope. Big round of applause for Tori, please. So for the next 45 minutes or so, we're going to walk through Endoscope, what it is, why Tori and crew are doing it, and then he's going to give us a little demonstration live on the screen there on how it works, and then we want to open up things to you guys afterwards. I'm sure you'll have lots of questions. So again, nothing's off limits here, so make sure you, if you have a question, let's take advantage of Tori and Quentin, who is the chief engineer at Endoscope. They're here to answer your questions. So I think the first question that always comes to mind when we're talking about, how many of these have you swallowed so far?
So I think I have 61 to date.
That's amazing. So tell us about yourself, why you started this. I mean, you've had a little bit of a career in medtech. Why don't you start a little bit about yourself?
Absolutely, and just a quick touch. We've got Sean up here as well. And, that really kind of speaks to the fact that, like, you might have a dream and you might very well identify with a company or a product, and if you go on to be a co-founder or a CEO, good for you, right? What an amazing story. But at this point, having more than 15 people grinding it out full time, maybe 25 that'll come by the office to actually contribute, it's pretty amazing. So my story begins as an aerospace engineer. Going to college down in Cal Poly SLO. I really appreciated their learn by doing approach, and they were very supportive of me going way outside the major and taking a lot of manufacturing courses, learning how to make stuff. And then my aunt came down with a glioblastoma brain tumor, and unfortunately we lost Katie, in the standard of care, 9 to 18 months later. And it just it lit a fire, and I thought, I wanted to play with experimental airplanes, but there were also opportunities to check out the local medical device startup scene. And I thought, we can't bring Katie back, but maybe, if we work together, we can create new kinds of technology that could help people. So I did many years in the local startup scene doing medical devices. First, a company called Insure Medical, which did vascular closure. So if I need to put a catheter in your body and pull it out later, we can poke that hole, close it. And that was a successful sale to Cordis Johnson & Johnson. And then that team asked if I would come and join them, cut plaque out of arteries. And so we were doing an atherectomy to open up blood flow. Spent 9 years with those guys at that company. And then finally, my last job working for other people was in endometrial ablation, where my co-founder Dan Moyer is actually in the audience with us, helping women avoid hysterectomy and doing endometrial ablation in a new way, using water vapor instead of like a radio frequency ablation where you have to deploy an antenna in a very sensitive part of the body. And so at the end of that journey, we had a lot of technical expertise from mechanical, but also deep electronics. And the opportunity finally presented itself to pursue this dream that I think many of us have seen in science fiction, which is tiny robot surgeons that come to rescue us when we're sick, right? And so the intent here with Endoscope and with PillBot is to take a tangible step in that direction.
So tell us about PillBot, what it is right now.
PillBot is a moving eyeball in the human stomach. The intent with PillBot is that if you're a patient and you have a tummy ache, maybe you could just be on a Zoom call with your doctor while they, find an ulcer or a lesion, right? And possibly be able to avoid going to a hospital multiple times to ultimately get an upper endoscopy where they would knock you out and slide a tube down your throat. It's a very effective procedure, but there are some hurdles to it, right? And so PillBot is really an intent to just kind of dematerialize all of the barriers to relatively advanced diagnostic access to inside the human body. And finally, thank goodness for the human stomach, because we can begin in the human stomach if you drink a fair amount of water, you make yourself into a little bit of a fish tank. And so it's a unique part of the body to begin the adventure.
You're trying to simplify. I mean, healthcare is, as many people in the room know, is difficult in this country for a number of different reasons. You're trying to, I don't know if democratize is the right word, but simplify part of the process right now.
It's really interesting. We maybe look into 1% of human stomachs in a given year. And a lot of that has to do with the costs and the barriers, and the fact that reusing an endoscope a bunch of times can bring its own issues. And so you just can't really do an endoscopy on everyone every time they have a bellyache. So the question is, what if we could look in the other 99% of stomachs? Or like, why is it that we still live in a world where you routinely hear someone has been diagnosed with a stage 4 cancer? If we're able in this community to really do our job well, we need to start finding cancers at much earlier stages so that we can give the oncology community that big head start, right? And so in our little section of the world, in the human stomach, we are hoping to show that a stage 4 diagnosis could be a stage 1 diagnosis if you can get this technology out into the population.
What do doctors say to you who know you're developing this?
Ain't no way I'm going to use that thing if it doesn't do X, Y, Z, right? Actually, we've had a tremendous amount of support from physicians. But I will say that physicians hold us to an extremely high standard, right? When you go talk to a doctor and you say, I have this idea and it's inspiring to me and I'm so excited about it, that's great, but the doctor is thinking about their patients. They're thinking about their ability to actually see what they're looking at, to manipulate, to take a tissue sample, to actually get a biopsy out of the body and into a lab. So then a doctor will look at PillBot and say, well, hold on. If it's just going to look around, what use is it to me? And the interesting thing is that we actually have an opportunity to work with doctors and basically say, we noticed in your practice that about 80% of the time, you're not taking a biopsy. If I could give you a virtual endoscope, just forget what it would look like or how it would work, but if that could actually be a real thing, would you be willing to use it? And then they say, well, yeah, maybe. All I will say, though, is that every step of the way, we've had to work very diligently to listen to doctors and understand that the results that we see in a fish tank in our lab do not translate to the results that they will see in a human in their clinic. And that it's very important for us to work with doctors every step of the way to make sure that we're actually getting the learning we need back into the product itself.
I know you want to walk us through a little bit of a presentation, but what's the current state of PillBot? Where is it at? FDA trials, I believe, are going on?
Yeah, I mean, in plain English, the current state of PillBot is it works great in a fish tank, and we're crossing into starting to work pretty good in the stomach. That's the transfer function. Why is it so good in the fish tank, and why do we have so many challenges in the stomach? Is it the mucus that gets imbued into the thrusters when we swallow it? How do maybe we drink water right before, or put interesting things in the lumens that can dissolve. It's actually a really fun set of challenges. But we have been doing clinical trials in New Zealand, thanks to our amazing friends in the GI community, all year long. And basically, initially, we just went there to get the safety information, make sure that there was some kind of a parallel between swallowing PillBot and swallowing a typically passive camera pill, right? But now we're starting to get our first actual diagnoses in the clinic. We actually had a patient with stomach polyps where we got this amazing footage of these polyps floating around from PillBot. And it's just interesting because at some point, we're going to find something really scary with PillBot in a situation where that patient never would have justified an endoscopy procedure. And that's when I think we're gonna have our first opportunity to say, like, maybe PillBot saved a life today. So I will simply say we are grinding our way towards locking the device down well enough to go do our proper pivotal trial and submit those results to FDA.
Do you want to take us through a little bit of a presentation and show us, maybe break down some of the parts and show people what PillBot looks like and how it works?
Absolutely. Do you want me to get my mom jeans on and my black turtleneck?
Go for it.
Here. So, folks, There is some form of this adventure that you've been exposed to before, right? And I think for all of us, there is a curiosity to go understand the universe and do amazing stuff while you're still alive. I mean, I think most of us feel this urge. And as an aerospace engineer, my primary interest has always been airplanes and space and going to the galaxies and like, why is the speed of light so slow? That seems really slow, right? Why is that our cosmic speed limit? But it turns out there is another adventure that we can take as well. And Richard Feynman, an amazing physicist, once said, there's plenty of room at the bottom. And he also said, swallow the surgeon. He was basically taunting us to try to build tiny mechanisms and machines that one day will be able to sort of shake hands with biological molecules at the molecular level. I think there's a handshake waiting to take place between the mechanical world and the biological world at a very small scale. And we want to participate in that adventure. And if there's 9 orders of magnitude, maybe we can be part of the first 1, maybe the first 2. Hopefully people will continue in our footsteps. So let's just kind of look back in time how we would go into the human body and collect health data. I mean, just 100 years ago, the way to go find out what was going on is you would just start cutting and looking for things, right? I mean, you would literally cut someone's body open and then put them back together and figure out what you had found. X-rays really started to change that. Nowadays, we have amazing tools like MRIs, where you can actually, with functional MRI, you can actually see in real time tissue doing really interesting things. But at some point, there is a threshold we want to cross, which is not just looking, but also touching, also doing, cutting, treating. And this is where if we can create an ecosystem where essentially the tip of a catheter or an endoscope is able to be maneuvered around inside the human body, minus the catheter or the endoscope or the hospital, we have some very interesting opportunities. So we want to talk about micro-robotics in the human body as a new ecosystem to do medicine and healthcare. And so our goal for today is basically to take that first tangible step. And so I would just envision a 12-year-old kid on their birthday flying an inexpensive drone around the park that they got for their birthday. That is now a very realistic thing. It's the world we live in today. So why not put a polycarbonate bubble around that drone, let its propellers push water instead of air, and make it hermetically sealed, and just squish it a little bit until someone can swallow the thing. That's what PillBot is intended to be, is the first drone that can swim around inside the human body. And then, well, let's use it to do other things. And so this is not entirely trivial, right? So obviously we have to get it small, we have to power it, we have to do some very interesting things with electronics, and we have to go to the edges of the earth trying to find someone who has already made a tiny electric motor that you can take advantage of. We are heavily leveraging technology from the world of cell phones, and thanks to the shootout in the smartphone world over many years, we have access to inexpensive image sensors, electric motors, thanks to AirPods and our relentless desire to go running. We have lithium coin cell batteries that have become not only very power dense, but also very current dense. The C rating that you hear about for electric cars to charge rapidly is also very relevant to us for a small cell to be able to develop a lot of electrical current and discharge rapidly. Because we only really need this thing to work as long as a traditional endoscope takes to do an endoscopy, which might be 10 minutes. So it's a fun ecosystem, and when you put it all together, you have the PillBot of today. And this is funny because this particular rendering is now showing signs of age, right? I can see so many parts of the device that have changed in just the last few months. So it's a very rapidly evolving ecosystem because, frankly, it's so exciting that the ideas are flowing through very quickly. So yeah, this thing does live video like a drone would do. It has headlights. We do a fair amount of electronic origami, which is simply to say that if you need a lot of space for electronics, maybe you could parse that into several circles and put them on a flex circuit and fold it up in fancy ways. Also, if you've ever been frustrated soldering lots of wires together, maybe you can turn your three-dimensional routing of wires into an extension of your flex circuit and do more electronic origami. So there's a lot of there's a lot of design fusion within the team of just basically trying to get the mechanical worlds and the electronic worlds, the software worlds all kind of matched together. And obviously we just had a wonderful panel discussion with many of our engineers to go into that. And what is enabled is this adventure right here. I'm hoping that in this room, there are some people who have some crazy ideas. I'm hoping that there's some people that have some crazy ideas that they've been thinking about and sketching and talking to their friends about that maybe they haven't yet figured out how to go incorporate that company. Maybe you have imposter syndrome. You don't think you're smart enough or wealthy enough, or maybe you don't look the right way that you think a founder should look like. Understand that you can start a tech company here in Silicon Valley with $5,000 to buy a 3D printer and build a football-sized prototype of PillBot, right? And take that onto a stage and see who's with you. And along the way, we have managed to build a lot of sophistication in. But this stack began, in a living room in Silicon Valley, like many others. And it's interesting, some of you will have seen me put a smaller robot into your hand today that I carry around with me. The one that we're gonna swallow today is actually maybe twice the volume. That's kind of like our donkey, our workhorse, our R&D prototype that has a little bit more battery power, a little bit more margin. And the question of, what is the workhorse that gets the job done? What's the marketable product? What's something that you can injection mold versus 3D print? It's constantly evolving. But the neat thing is, it's finally become something that we can actually put into the human body and do real clinical trials and testing. So we feel like this is very much becoming real. And a look into the robot itself just kind of speaks on some of those areas we touched on. So you can see electronic circuits that have been folded into some really elegant shapes. The antenna itself is no longer a piece of copper wire stuffed inside the polycarbonate dome. It is now a trace on the flex circuit. And this is stuff that you would see in other forms of electronics, but it's neat in the medical device scene to really get engineers from many disciplines to be cross-functional. I think a beautiful thing about this project is that it brings out flexibility and elasticity in our creative thinking. And many people who thought they were mechanical only are starting to write code, and people who are writing code are starting to design their own circuits. And people who are designing circuits are realizing that the circuit design software just needs a 2D shape to begin with. That 2D shape may very well look a lot like the 2D export of a three-dimensional SolidWorks sheet metal construction. And so you have mechanical engineers realizing that they can do some crazy electrical engineering too, with the right friends in the right setting. So it's a fun world of miniaturization. I think you can kind of see here, that flex circuit folds up like you see here. That kind of turns into the front of the device. We've got our headlights and our camera, and trying to keep that antenna sort of away from other things that would obstruct or reduce your radio connection. And you need some motors. I wish we had 4 motors on it today, because then I would have, additionally, I would have some pitch input, I would have some roll input, but we made a compromise. We took a motor out, the device got a little bit smaller, the battery lasted a little bit longer, and with 3 motors and some ballasting, we're able to do some pretty decent 3-dimensional motion. So constant compromises to make this a tangible, real thing. And so if we can do this, if we can put inexpensive drones inside the human body, it provides an opportunity to sort of take the world of endoscopy and bring an advanced scout in that can go out into the communities and do the basic scoping, the hunting for basic illness. Let's move that out of the hospital. For the sick patients out there, let's bring them into the hospital much more quickly, and let's begin to deploy some amazing tools that we've all been reading about in the news. I mean, for example, the opportunity to bring in artificial intelligence means that a gastroenterologist who has trained their whole life to have these amazing skills doesn't necessarily have to be the boring city bus driver looking for yet another lesion, or worse, to find yet another clean stomach. That gastroenterologist can actually be working all day on extremely sick patients with advanced disease, right? We will find that disease out in the community and bring it to the doctor, bring it to those amazing resources, and then let the simple screening happen outside. Now we're going to do some really interesting things with AI, and thanks to companies like our buddies over at Virgo SVS, Matt Schwartz, we already have huge precedents for doing artificial intelligence work on the imagery that comes off of endoscopes. And so we're really standing on the shoulders of giants. The AI push has already been pushed for years, so we don't really need to consider that an epic uphill battle. We will say that we think we might be creating the fountain of data in the human body. And this amazing data set that we can build together is something that we'd like to talk to everyone in this room about how we can collaborate and put that healthcare data to use, saving lives and making people feel healthier. And so there are some next steps coming for Endiotics, for PillBot. I think one of the big ones is the TX in Endiotics is treatment, right? Endo is to go inside, dia diagnostics to understand what is wrong. TX is pill surgeon, right? TX is we found the thing and we cut it off or cauterized it. Or perhaps we did a little bit of lab on chip work. Maybe we could take a sample and analyze that sample on the robot itself and not have to send that to a lab. I certainly do not recommend any of you retrieving your PillBots. That's something I have to do frequently. It's not necessary for patients, right? There are so many things that we can do on the robot itself. And so I think this company is going to focus on what can we do using little swimming robots, because we think we can do a lot more than we even imagine today. But then we're not here to say that the hospital is bad or that the endoscope is bad. We're here to say, let's use those resources most effectively, right? And the last thing that I get really excited about is when I tell people that I'm still thinking about my Aunt Katie and her glioblastoma, that brain tumor, which unfortunately is like a slime mold as it moves its way through your brain. It's not like a simple lump that if you could just remove that lump, you're good to go. Cancer is often very diffuse and hard to define. It's hard to know what is and is not healthy. And so you can't just go cut the whole thing out and be done with it all the time. Sometimes it's complicated, right? And that's where, imagine if you didn't have to do a brain surgery once. Imagine if you had a rice grain size version of PillBot. It would probably have little legs. It would probably have a tail, right? It would look like a scary parasite. But maybe that thing would be able to worm its way around and park itself where it thinks the periphery of a tumor is. And maybe you could have several of them working as a team for weeks or for months. It's kind of a really amazing world that we can tap into if we can first show that a robot can swim around in your stomach and do some real medicine. How would you power something like that? I'm starting to look at very interesting nuclear options. So Endiotics is really hoping to, with an exciting pilot prototype product with PillBot, we're kind of hoping to get people excited. We're hoping to add a breath of fresh air to the world of the upper endoscopy. And from there, let's take this traditional hospital industrial complex that we have so many mixed emotions about, and let's bring a lot of that healthcare back into the home. And I sure wish this was my home. I think this is an AI prompt. So with that, I would like to sit down and allow my chief engineer and Sean to sort of step up, and I'd like to become the patient, and I'd like to hear what you guys have to say.
So we are going to start with him swallowing a tiny pill that is going to be our cameraman, the videographer that's going to see the real PillBot in action inside his stomach. So please swallow this.
Okay, so let's, got my antenna, and I've got this guy, and I swallow it.
Please, yeah.
Okay. Okay, so I'm gonna drink water.
So this guy is configured so it's super heavy. It's just gonna be at the bottom of the stomach, and it's gonna look up. And inside the stomach, the other PillBot, this one, is actually gonna fly, and we are gonna see this in real time inside the stomach.
And you're telling me I have to drink all of this?
Yeah, please.
The things I do.
Okay.
So he's drinking all this water to what? Just help flush it down to the bottom of the stomach, like you said?
So this is to inflate his stomach. So the stomach is becoming a big pouch of water. The fish tank here, basically. And for this, I am going to turn on the other robot. And I think we're going to see a feedback on the screen. Yeah, you can see it here. Perfect. Could you give me your antenna, please? Thank you very much. So we are going to place the antenna close to the fish tank, and then put the robot inside the fish tank, and then with a joystick here, I'm gonna control it. Yeah, okay, perfect. I'm removing all the bubbles. Perfect. As you can see here, I have full authority on the pill to control it clearly.
I think I got my hydration for the week.
You have to step out for a minute and go to the bathroom, or you're good?
Many of you will have noticed me making little bathroom breaks. I think our hope here is that we can have some fun and put on a show.
Yeah.
The hope is that the tech stack evolves into something that our grandma possibly on her own could do. And that's not gonna be drinking a fish tank full of water. Maybe that's a pint of water, or maybe it's 2 pints, but the hope is that it's something reasonable.
Is there anything else that you have to do, before you're drinking water? Is there any other prep that's involved?
Yeah, so right now we're using a compound called simethicone, which is, they put it in baby drops to help reduce gas with your newborn baby so their tummy doesn't hurt so much. That simethicone is a pretty easy to obtain thing, but it helps to reduce the bubbles a little bit. And we're constantly testing at the office to see, do we really need it? How much do we need? Because again, if we can create a protocol that anyone could do with a glass of water and a pill, and maybe an internet connection, then this can reach so many people. But if we find ourselves doing more and more complicated prep, that reduces the kind of people we can reach, right? And at the extreme end, you ask yourself, is this any better than an endoscopy? So we're kind of constantly trying to push forward in the hope that we come up with something that is actually special, differentiated.
Yeah.
So now I'm gonna grab this little guy and give it to Tori with the antenna.
Okay, so I've got the antenna, and then I've got, is that, hi guys, everyone wanna wave? This is kind of fun. This is you. So, well, this is fun. Let's go ahead and see what we can do. I got a little one. Woo! All right.
So I think we're in the stomach right now. Okay, so what I'm gonna do right now, as you can see on top of the image here, we can see some white cloud. This is mucus. The stomach usually creates a lot of them all the time. And for us to drive the robot inside his stomach, we need to avoid it at maximum. So right now what I'm gonna try to do, while Tori is here, standing still and not talking, controlling his breath, I'm gonna try to get out of this white cloud, the mucus. So let me go here in full screen. And I'm gonna try to move forward. So here we go. We can see this big cavern, and we see the PillBot. He swallowed a couple minutes before. So here I'm trying to drive away from all this white cloud, so I can go up and perform a procedure. Here we can see the duodenum, this weird shape that I'm trying to reach that look like a black hole in space.
Do you have other views on your screen? Or how do you know where you're going?
Oh, so the video you are seeing here, it's exactly what I'm seeing on my screen. And I'm only directing myself with the camera view, but if I wanted to, I could have all this telemetry data with the battery, the connection, and I have here the motion input on the graph, and I can have full control on every thruster, because as Tori explained, it moved things to little propellers and thrusters that push the water really hard, and I could have a really fine control over all of this data. But here, I could just put it in full screen, so we have all a better view.
Is there any latency? So when you're controlling it with the remote, is there some latency as for when it moves in his body?
There is a latency.
Yeah.
The latency is pretty minimal. We don't feel it as a driver, but of course there is a latency. The chain of command on the whole pipeline is pretty heavy. So we estimated about 50 milliseconds. And
how is it transmitting the data? So how are we getting the images off of the camera that's inside to the screen? Maybe explain that.
So on the PillBot, as Troy explained, we have a folded antenna that transmit to the tiny antenna you have on his body right now. Yeah, the tiny stick that is directly connected to a dongle I plugged inside onto my computer that decompress the data and create these images, because the amount of data we could transmit over radio frequency is pretty minimal. But if we compress it, thanks to a custom algorithm, we could decompress all of this data and have a pretty decent field of view, but also frame rate. The frame rate right now is about 7 to 10 FPS. Yeah, we can see it here. And it is pretty drivable. I would compare this to an early DJI drone, one of the first ones.
What do you mean? No, okay, there it is.
But that's definitely our goal, to have a robot that do the procedure automatically. The first step is we have a doctor having this controller and driving it inside the stomach. The next step is the patient just swallow the pill and generate a report automatically. You do all of the scan, the 360 scan, and then extract all of this data to generate coherent report that the doctor could analyze.
So it's moving autonomously is what you're saying, then through the body.
So right now, Kantan is doing direct control
Sure, yeah.
with the Xbox controller, but we see an immediate opportunity to let AI start just doing an autonomous mapping, create a 3D map, generate the 7 still images that are usually part of a typical EGD outcome, see if that is able to qualify as a screening for certain patient populations, but kind of always leave the ability for a gastroenterologist to jump in, seize the controller, and use it as if it was an endoscope. One thing we're excited about is that it took a long time to get to the video that you see here today, which is highly mediocre, right? 480 pixels. The actual optical quality is not perfect. And then frame rate of 7 FPS, that's not good enough to go play Counter-Strike. But something that we're excited about is over the next few months, we have some amazing stuff in the pipeline where we do have to balance what the cost of goods will be against, do we even have the engineering resources to write the code? But we have on the drawing board now some devices that might actually start to threaten endoscopic quality in terms of really big resolutions, frame rates. We're starting to learn about computational photography, which basically just means when you pull your iPhone out and start shooting pictures, there's a lot of stuff going on under the surface to give you that quality that you're used to. We're only beginning to build that into PillBot.
How are you, maybe this is more for Quentin, but how are you adding the autonomy, technically, how are you doing that? That seems like a very complex problem. Is it worth, what's the benefit of making this autonomous versus just keeping it in its current form of being remotely controlled?
If I could grab the question, why would we do that? First of all, we won't do it immediately, right? PillBot is intended to be telemedicine at scale out in the world. But our first regulatory approval is aimed at, let's just sit down in a clinic, just like we are here, and see if we can do an EGD in our normal street clothes. If we can do that, then let's go to FDA and say, hey, maybe let's do a special 510K and talk about doing this through telemedicine, like people started to pioneer during COVID with camera pills. AI basically asks the question, what if instead of one doctor treating one patient at a time, you had one doctor in the loop treating 1,000 patients at a time? And that's kind of how we reach the people that just don't get reached by modern healthcare.
So potentially have folks use these in their homes, maybe?
Yeah, I mean, imagine you could just say, Alexa, my tummy hurts. And Alexa...
Amazon drops a PillBot off at your house, and here we are.
Why not, right? And the neat thing is, I wish I could tell you that we invented that and that we want to take the credit for it, but the Mayo Clinic actually did some amazing pilot work during COVID doing passive camera pill swallows at home, which made a lot of sense because we were really trying to cut the transmission rates of that illness. And so there's sort of a regulatory framework in place already for people swallowing electronic capsules at home and having a physician in the loop with that.
So you feel, obviously you're a little full from all the water that you drank, but besides that, you feel nothing?
I don't feel anything. I will say that some of the bigger prototypes, you'll feel them when you swallow them. Our intent is just to get so small that it really just does feel like a multivitamin.
Quentin can't jab it into your belly or your ribs or anything.
I wish we had that kind of motive force. Right now, like we're seeing a pretty good view here. We're getting some good movement, but we've spent many years trying to get the ability just to drive over a wrinkle or hover in place. It's taken a long time just to get to what you see here.
What have you done to build up the safety of what we're seeing right now? I mean, there's power things that are happening in there. What have you done to right now ensure for yourself that nothing is going to go wrong?
Well, in the ways that we are similar to a camera pill that doesn't move around, we want to look at similar shapes and materials, sizes, right? We tend to look and feel a lot like a camera pill. And so we have about 25 years of data that helps us understand what is safe to swallow, what is not safe to swallow. However, what are we doing that's new? I mean, we're using very powerful lithium batteries in this device. And so what we do, and what FDA was actually very helpful with, is they sat us down and they said, we'd like to look at your engineering plan for how we can do this safely. The way that we look at our lithium batteries is we say, what is the worst possible failure mode? How can we trigger it? And then how can we design a robot that can handle that, right? And so we're not here to say it's never gonna go wrong. We're here to say everything is going to go wrong, and here's the work that we've done to make sure that that is an acceptable event, and here's what the chain is going to look like after that event occurs.
I'm sure the robotics engineers here have a lot more intelligent questions about how this all works, and for medical folks as well. So let's open it up to questions right now, if that's okay. We have just under 20 minutes left. There's a couple colleagues that have microphones that can help. We'll pass them to you guys in the crowd. So just make sure, just raise your hand and we'll get you a microphone here. But maybe Quentin, a question for you is, we often talk in robotics about simulation and testing something before deploying it in its actual environment. Is it possible to simulate something like this? What are some of the techniques that you guys have employed on the engineering side to gather the data as to how well it's working, and maybe some areas where you would like to tweak some things?
Yeah, that's a really interesting question. And one of the co-founders of NDRX, which is here, Dan Moyer, is actually working on simulating exactly what you're talking about, using external camera to simulate the movement of the PillBot to understand every part of it, because we are at the microscopic scale. The fluid and basically the whole environment is different. It's not like playing with water or with hair. It's a pretty different environment that usually simulation software have trouble to replicate. So we unfortunately could not have used simulation software, digital twin, etc. That would be perfect for this use case. But it's a really specific field, and these tools are really tricky to handle all the side effects. One of our older robots used something called the Coulomb effect, which is a really specific effect in the fluid dynamic field that basically, that's interesting. We can see some.
So one of the fun things, this is a shot of bile that has just been released from my duodenum. The duodenum, that's where your bile duct comes in. Right after the stomach, you have this first segment of your small intestine. And typically, bile is released in there and goes downstream. But if you drink a ton of water, it kind of tends to dilate the duodenum open a little bit. And then that bile shot will often go retrograde back into the stomach. And so one of the reasons why you saw me rolling around drinking simethicone, not drinking water, then drinking a lot of water really quickly, is that we wanted to make sure that we got a chance to swim around in a relatively clear stomach before the bile shots started coming in. So it's kind of a crazy workspace over at MDRX because we're constantly doing this.
I would say that's pretty crazy, yeah. That's wild.
And let's probably use the camera pill to see the movement of the pill I'm actually controlling. So yeah, here is the view from the robot down the stomach. And the light on top of it is the actual PillBot. And
Sorry, I'm gonna hold still.
The one that you're controlling is up the top, yeah.
yeah, correct. So I'm gonna try to fly it so we have some good shot. Seems that it's on top of the stomach near the esophagus. So I'm gonna try to go down. So here it's a perfect shot because we can see at the same time the esophagus where the light is, and just before you saw this really interesting black hole, which is the duodenum. What Toy just talked about.
Yeah, the clenched fist is the pylorus, which is the sort of separation between the stomach and the duodenum. And
Is that it on the top there?
let's have a look here. There we go. So on the right-hand side, you can see a little bit of a clenched fist. And then what appears to be the fold in the middle is the stomach is kind of kidney-shaped, and we have a very wide-angle lens, and it tends to sort of compress things a little bit. So you're seeing most of the stomach right now from the camera bot.
Wow. Does anybody have any questions? It's hard to see up here. Oh, go ahead. Somebody has a question.
Sorry, I may have missed it, but how long is it supposed to be in the body, and how are you getting out?
Yeah. So this is where I kind of have to put on my business hat, and I'll go around and I'll ask gastroenterologists, how many minutes does it take you to do an EGD or upper endoscopy? And they'll say, honestly, I'm usually only touching the endoscope for 5, 10, 15 minutes. And we realize, holy cow, if we can do an active procedure that replaces an endoscopy, this device would only need to work for a few minutes. And we're addressing a market that's 100 times the size of the passive capsule market by being able to put pressure on the endoscope. And so it's amazing how a much shorter procedure can actually have a lot more volume because it swims. Next question is, when you forget about it, about 24 to 48 hours, this thing better end up in the toilet. And if it doesn't, we are working on ways to understand has it safely left your body, just because you want to make sure that this thing eventually does make its way to a wastewater plant.
Has that ever happened to you? I mean,
So it hasn't happened to me. In the
63
times I've
60%?
swallowed a robot, 61 of them have come out, right? And then, well, you know, hopefully these two do as well. But when you do this millions of times, when you do it millions of times, especially in the early days of camera pills, when we didn't necessarily know who was safe to swallow one, who might not be safe to swallow one, once in a while, just about any object can get stuck in the GI tract. And it's really important that we kind of understand, first of all, how do we minimize that? And second of all, how do we make sure that if it does get stuck, we know about it and we can get that patient into a treatment facility?
Is there any other questions so far? Oh, there's some people raising their hands. Gene, let's go to Brianna's question first.
This is really cool. I actually have two questions. The first one is, do medical professionals need training? Is there a chance they may accidentally misnavigate the pill somewhere it shouldn't go? And then my second question is about the connection stat. It was right underneath where it said battery, and what influences that?
Yeah, so first question, and can you repeat the first part of the question real quick?
Do medical...
Okay, thank you so much. So training and situational awareness. We went to Digestive Disease Week, and we just brought gastroenterologists into our room and, you know, gave them the Xbox controller, throw the robot into the fish tank. And immediately, within 10, 15, 20 seconds, they were playing the PillBot video game. However, years later, we are still trying to get the situational awareness where when you see Conton fly in the fish tank, you'd think, we're done. We have a company, right? Like this is, it's amazing, right? In the fish tank, you feel like a superhero. But once we swallow it, all of a sudden, we only have the live view from the robot, and our situational awareness is very, very different. So we're kind of doing two things at once. One, we're beginning to build digital tools where we're going to create some really cool 3D digital renditions of where we are in the stomach at any given time to sort of give you a virtual sense of situational awareness. The other thing is, here in the lab, we realized we could cut one of our robots in half and just have it be a cameraman and basically give you some of the views you've seen here. And that situational awareness has been really effective in helping us to rapidly advance right now. So I will simply say that while one part of it might be easy, you might be really, really struggling with another part of it. And our friends out in the world who are using magnetic fields to move camera pills around are also saying that they have trouble sometimes with controllability and situational awareness. So it's a complex and fun environment. I just say that once this is a satisfying and fun video game to play, we've done our job right. Now that's the first question. Can we repeat the second?
It was just about the connection stat and what influences that.
Well, what I could say is that if we tried to get a Bluetooth signal or a Wi-Fi signal at 2.4 or 5 gigahertz through your body, it's going to get through like a quarter inch of tissue and just die completely. And there's some amazing work being done up at like 65 gigahertz where you get this insane high bandwidth. It's amazing. But at those high frequencies, it works like a flashlight, and physical objects cast shadows. So how do you see through physical objects with radio frequency? You just drop the frequency down. This is a trick from the US Navy communicating with submarines, where you basically just go down until you do get a radio signal through the body fairly reliably. For us, that's at about 915 megahertz. A lot of camera pills operate around 400 and 433 megahertz. For us, we're at the highest frequency possible that with our hardware we can get a good link. That gives us a little bit of extra bandwidth. But the real magic was taking a data rate that might be like 1.6 megabits per second, if we're lucky, 700 kilobits per second, you know, for years. How do you get a video signal with so little data. Let's put on our Silicon Valley middle out hats and basically come up with a really fancy image compression algorithm. So one of the many magic bullets, if you will, that the team has managed to create to build PillBot as a functional stack, or a stack at least that functions to the level that you're seeing here, is we do some really advanced image compression on PillBot so that we can then send that highly compressed packet out to pop that into a big picture and give you some semblance of live video. And you can see here that it's on the threshold of good enough quality and good enough frame rate. Like it's absolutely not great, but we hope you might credit it as mediocre.
Question in the front here.
Sure. So I just had two quick questions. The first is, I know you guys have got, or we've got a bunch of really smart engineers, mechanical, electrical. We also have software engineers. Just wanted a quick deal on, hey, what's some of the cool software engineering we've done recently? You know, what are some of the really cool tricks Sean, Quentin, and team have done? Second item is, I know we have a lot of really smart engineers. We've been literally running patent workshops and cranked out a bunch of patents. Could you guys speak to recent patents that were approved? And then also microsurgeon and PillSurgeon and some of the cool patents that are in the development stage.
I would say that one of the great leaps forward recently on the software side, thanks to the team that just spoke. I mean, there are others making a contribution as well, but you got to see a good portion of the engineers today at the panel. Was multiple aircraft, multiple bogies. That's like your Top Gun quote. We are now flying multiple robots simultaneously, and so the robots are swapping frequencies, and we're able to do frequency hopping and basically come up with a custom channel for each robot. It's no longer like there was only ever one dongle and there's only ever one PillBot, and that's the end of it. It's turning into a really sophisticated environment where you can start to do really weird things with the platform. And by weird, I might just say it looks like it might work as a product soon. On the IP side, we just had a big breakthrough where we got a letter from the US patent, the USPTO, and basically said that the PillSurgeon IP work has been granted. And that doesn't mean that we now have a PillSurgeon, it just means that we can pursue putting a simple set of tools on this thing, right? So some GIs are saying they'd like a tattoo gun on it so they can put a little mark that they can see later. We're thinking, hey, we can put some drug in there. One of the doctors we're working with is saying that he is shrinking stomachs by putting a series of scarification injections at various locations in the stomach to just cause some scar tissue to form that then shrinks the stomach over time. It's a bariatric procedure. And we're thinking like, holy cow, PillBot could have a tattoo gun on it with a scarifying element and just go do simple injections and potentially help someone shrink their stomach. And like, you're talking about gastric bypass surgery being diverted into PillBot telemedicine. And so we have to be clear, we're not here to take the whole hospital and make it go away. We're just saying maybe we could take little bits and slowly bring that into the realm of digital health.
Go ahead. Did you have something to say? Oh, anybody else have a question? Question, I can't see.
Hi, just one question, amazing demo. How do you feel? Do you feel the emotion?
Well, I will say that I haven't eaten any food in maybe like 18 hours, and I'm just really glad that I live in the San Francisco Bay Area where there is amazing food everywhere. I feel a little silly because I drank a bunch of water, right? Like I'm trying to give myself the biggest possible stomach volume to give Quentin any chance to swim around for real and put on a good show. But in general, it's kind of just like drinking 2 pints of water. You feel pretty
You
good.
don't feel the PillBot moving at all?
My advice is, yeah, you don't feel it physically moving, but you might feel it when you swallow it, right? We have to acknowledge that. My advice is, when you're doing your public robot pill swallow demos, try to book them for like 10 a.m.
I think there's a question in the back there. Go ahead.
Yeah, I have a question.
hardware at this level, how much of it is like is it remotely controlled? I know you mentioned features like being able to hover in place, and I'm curious how much of that autonomy is being communicated at the device level. Can you send any kind of software down to this at all, or is it just purely 100% remote control?
What I would say is that right now we are bouncing off the walls, playing Mario Kart, directly engaging the control sticks, right? Which means that we are using way more battery than we should be. We are having situational awareness issues where, like, you saw the other side of the stomach, so you went forward, and all of a sudden you're bouncing off of the wall instead of gently approaching it. So the next few months for us, I hope they're the next 3 months, but you know, it could be the next 18, right? The question is, put the business hat on. How do we take one of those numbers and make it look like more like the other number, right? We have inertial information thanks to a gyro chip on the. Are we done finally?
Yeah, thank you.
So
Let's give it a round of applause here.
We have inertial data. We are beginning to build motion models that will allow us to do more sophisticated direct control, but the real direction this is heading is just, we've all seen a drone just go fly and hover in space, and then when you tell a drone to do things, you're not really telling it 1,000 things to do per second. You're generally saying, stay there, or rotate 30 degrees, move down. The robot should be able to do the rest of that, and we are hoping that the PillBot ecosystem will bring what you would expect from a normal drone into the PillBot platform. So they can find the center of the stomach, hover there, easily move around. Right now, we're driving around wrinkles and getting stuck in crevices.
Sure. Maybe one more question, Spencer, go ahead.
Yeah, so what is the maximum frequency that you can get like decent feed at?
Do you mean like FPS?
No, I mean like in terms of megahertz, kilohertz, like the radio frequency.
So
just try to control stuff underwater.
we think the LoRa bands 915 thereabouts right now is about as high as we can go, but there's also some interesting new protocols on the horizon. Wi-Fi Halo is kind of interesting, but I would typically say like 400 megahertz to a gigahertz is probably the area to explore. But with the work that we've done with Pi networks and auto-tuning in real time, we're finding that there's a little bit more elasticity than we thought there might have been several years ago. So I don't want to say that it'll be this frequency forever. We might find ourselves going in either direction. And there are other ways to send data through human tissue. So it's an interesting world.
Awesome, thanks.
So we only have about 45 seconds here, but obviously thank you very much to you and to Quentin, Sean, and Shelley, and the whole team for being here and for doing this. But just want to give you, a final closing statement. One of the things that I've only talked to you a couple of times here, but one of the things that I think has become apparent to me talking to you is that you're not afraid to take a chance and take a risk. And you don't know how to do all of this yourself, and you put together obviously a very interesting team that's trying to do this and make this into a product. But maybe just speak to that and what's next for you guys.
Well, what's next for us is just hopefully continue to work with this community, right? This is a community where, on a personal note, I started as an intern making $15 an hour in 2006, and it helped me become an engineer and eventually get names on patents and eventually build the courage to ask people to help me launch this company. And so I feel like the health tech community is a pretty amazing ecosystem. And now, when we see some of the other communities, like the folks over at SpaceX that just caught the Super Heavy with Mechazilla, I'm thinking, wow, that's cool. But what can our community do together, right? I think that there's a renaissance in new health technology that we're already in. And I just feel really privileged to be a part of it, and I hope that other people know that they can use us as resources as well as you launch your ventures out there.
Yeah, what a great mission. So thank you so much, Tori Smith, CEO, co-founder, NDAddicts. Thank you. I don't know if I'm I'm sure he'll stick around for a few minutes, but that's going to do it, folks, actually, for RoboBusiness 2024. Thank you, everybody who stuck around. We will be back here. RoboBusiness 2025 will be back here at the same place next year, almost the same dates, mid-October. And then our next show is coming up April 30th and May 1st, 2025.